Great. Good morning, everyone. My name is Richard Hatzfeld, and I lead the Global Health Impact team at Finn Partners. We're a global PR consultancy and integrated marketing firm, and I am delighted to be here with everyone to share some insights on the Canadian healthcare system and really some of the areas of innovation that are taking place in Canada. As you would expect on a November day, it is snowing in Canada, and at least in certain parts. So that's created a little bit of an interesting time for us as we start to assemble some of our speakers. And you'll see Janet Bannister is in the car, and I'll introduce her in a second, but she'll be in the office as she's navigating Toronto's snowstorm this morning. At the same time, I understand we have close to 300 participants on this call. So I'd like to welcome all of you, and we'll get into the conversation. As I mentioned, my name is Richard Hatzfeld. I'll be serving as your moderator, and we expect to have a fairly lively conversation. A lot of interaction between participants. This isn't going to be the kind of stilted discussion where we just go from question to question. I also will challenge you to something. I've been told that in webinars of the past, we don't get a lot of questions, if any at all. So my challenge out to participants is add some questions. Put those questions into our chat. We expect to have hopefully about 5 or 10 minutes at the end, and we'll be keeping track of the questions. And if we have at least 5, then I would say that's a measure of success for this webinar. So with that in mind, before we jump in, I just want to make some quick introductions. Around the table, you have a bunch of different folks. So Marie-Renée Lajoie is an emergency physician, and she's also a partner at McKinsey & Company, and she will be providing us with an overview of the Canadian healthcare market that will really serve as an anchor point for us to have a more in-depth conversation around some of the areas of innovation, some of the areas of health tech that are taking place, and certain challenges. You can expect Marie to play the role of Mythbuster on this, and so she'll be talking you through a few areas that I think will be very interesting for us to explore in the Canadian healthcare market. Second on your screen, you have Shaf Kashavji, who is a thoracic surgeon. He's also Chief of Innovation at UHN, which for many of you may know is Canada's #1 hospital, and it's also ranked as #1 in publicly funded hospital. And so I think Shaf is going to have some very interesting insights around what it really takes to build an ecosystem of innovation that really translates also down to patient care. Next, we have Alison Secular, and I hope I nailed that. I probably didn't. She's cooler is how I try to remember it now. And Alison is President and Chief Scientist for the Center for Aging and Brain Health Innovation, or CABI, which is a core program at Baycrest, an academic health sciences center, and one that is really kind of on the forefront of providing a continuum of care for aging Canadians and older adults in general. And last, we have Janet Bannister, who is still in her car navigating the Toronto snowscape. And she is the managing partner of Staircase Ventures, which leads seed stage rounds of investment into Canada's highest potential tech companies. Before I turn it over to our panelists and to Marie, who's going to provide us with that anchor point for a presentation, I wanted to first also introduce Esther Howard, who leads Bezel. And this webinar is a preview of sorts to a delegation that's being led by mHealth Israel and others to Toronto in December. And so Esther is really in the forefront of leading that and organizing that delegation. So I wanted to give her a couple of minutes just to provide some information on it. Go ahead, Esther.
Great, thanks. Good morning, good afternoon, and good evening to everyone who's joined. Thank you for such great participation. So my name's Esther Howard. I'm the CEO and founder of Bezel, which is a digital mental health research platform that bundles opportunities of mental health to communities and organizations. So I'm excited to share that in December, from the 16th to the 18th, Myself and Levi Shapiro from M Health Israel will be leading a special delegation to Canada focused on healthcare innovation, well, specifically for brain health, innovation, and collaboration. So we will be bringing together leaders from mostly Canada, but we will also have some people from the US and Israel there to meet with payers, providers, and investors. You're going to learn a lot about Canada's healthcare system in this webinar, and hopefully that gives you enough information to make you want to find out more. And you can contact me or Levi, easy to find us on LinkedIn or through this the collateral in this webinar. Thank you, Richard, and I'm looking forward to the rest of this webinar.
Thanks, Esther. And we'll also put your email and Levi's email in the chat here so people know how to get in touch with you. All right, Marie, over to you. Let's start the presentation.
You bet. Well, it's a pleasure to be here and a real privilege. As Richard mentioned, I'm Dr. Marie-Renée Bélajoie. I'm an emergency physician at the Jewish General Hospital in Montreal, affiliated with McGill, and I'm a partner with McKinsey & Company. I co-lead our Canadian healthcare practice and obviously deeply passionate about the topic of healthcare in Canada. What Richard did not mention is I spent my first 5 years at McKinsey in Boston, and I'm sure it's all top of mind to you. Why would I do it with Canada when there's as much venture funding in Kendall Square than there is in our entire country? Well, I certainly hope to walk you through a few myths about the Canadian healthcare system and hopefully change some of that thinking for you. You allow me to walk you through a few pages, and I'll be fairly brief because really the stars of the show are all these other amazing panelists with us today. But let's jump right in. All right. Okay. Apologies for this. Voila. So 4 myths I'll be walking you through today. 1, that Canada is one healthcare market. 2, that Canada is a public health system. 3, that Canada is too small to matter. And 4, that tech in Canada is complicated. Well, I know many of you think of Canada as one big whole country, and we are. We are the second largest country in the world. I used to joke with a lot of my friends when I worked in the Canadian Arctic, in a Boeing 737 from Montreal to the tip of the Black province in Quebec is as long as heading down to Miami. So not a small country to be part of. But when our healthcare system was funded through the Canadian Health GAC back in the 60s and 70s, one major decision was taken in our confederation is that our healthcare systems will be managed provincially. So for you who are more familiar with the American healthcare system, that means largely no Medicare, and very strong Medicaid. In fact, most provinces will cover 90 to 95% of the citizens with one provincial coverage and will operate the healthcare system in the province, leading to very unique designs, different structures, different procurement mechanisms. So I often say, really, Canada is 10 different healthcare systems. The one exception is Indigenous health, which is managed at the federal level and operated at the federal level. But it's really one important nuance that many often miss as we think of Canada. But given recent geopolitics, our newly elected Prime Minister in early 2025, there's a real move to integrate Canada more strongly, and that includes in healthcare. And you won't be surprised that, in fact, many of our healthcare companies also operate at scale in Canada across several of its main markets. And we have trends that are very similar to the US and obviously European market and also Australian and others. I won't spend tons of time in many. I expect many of those to come up as part of our discussion today, but just to head them quickly to give you a bit of color. So obviously our population is aging like most Western countries. That means also an aging workforce. So the strains on employer and the incentives for employers to address the needs of the workforce are also shifting and changing. Canadians are deeply connected. Our broadband penetration and connectivity across the country and our digital health expectations are increasing by the minute. We have access to many of the similar services that you have in the US at a certain scale, which means Canadians' expectation now of a kind of convenience care touch at the click of the button is very similar to everywhere else in many developed countries. It wouldn't surprise you discussing the cost and prevalence of specialty in GLP-1, 2. In fact, Canada has one of the strongest pipeline in cell and gene therapy as we look ahead. And why? Well, pharmaceuticals see this as a fantastic test market. Obviously, I'm sure if many of you in the pharma space, there's a lot of uncertainty around tariffs and global supply chains, but Canada remains in the top countries reimbursing drugs with increased growth. So obviously that has significant impact on our markets. And the other ones that wouldn't surprise you are workforce challenges, consolidations in value chains across the healthcare journey, and obviously regulatory shifts as our health systems navigate the current aging population. Myth number 2. Canada is a public health system. Well, I still fundamentally believe that that's true. But when we look at our number, I think it's important, especially for those that are less familiar with Canada, to remind yourself that about 30% of the spend in Canada is private. So that puts us among some of the highest in many of the OECD economies, obviously not as high as the US, which really stands in a market of its own, but we are as high as Australia, and very high among the average, which obviously is risen because of the US. But when you think of many other markets, Canada stands out. And you're going to ask me, well, what do we mean by private? So this is a little bit of a complex side, and I won't spend too much time detailing all the pieces, but a very simple way of understanding is the bulk of our system is publicly funded. That means levied through taxes, both at the provincial or federal level, depending on each of the specific provinces. The health system will be designed, operated, and paid for at the provincial level. And there are a certain subset of services that will then flow at a range of kind of national, provincial, and local level. And on the right-hand side of this page, in the kind of lighter blue, about 27% of the market, close to 30%, is private funding. So what that means is about actually 75% of Canadians will have supplemental health benefits paid through their employers. So if some of you are familiar with the recent rise, for example, in Dialogue, a leading Canadian telehealth company recently acquired by Sun Life, this is exactly their markets. They're appealing to employers to provide a service to their workforce, and are channeled through some of these employer paid for supplemental benefits. And individuals then say will often pay through Worker Compensation Board and out of pocket. It pains me to say, but out of pocket cost is rising in Canada. The largest share of costs are pharmacy, elder care, so private home care, and dental care. So obviously, little less known facts for most of those learning about Canada. Canada's too small to matter. Well, first, there's nothing as too small, but I know for a lot of folks, that's top of mind. So just to anchor, if you paid attention to some of the prior slides, our Canadian healthcare market is about in the range of $340 billion. When we start looking at the share of those revenues, it sits in 4 major buckets. So if you focus your eye on the left-hand side of the page, we're looking at pharmacy services, providers, and payers. Obviously, pharmacy and provider being a large share publicly funded. And then we then have the health service technology angle, which sits in its own little bubble on the edge. And essentially what we're saying here is this is where we're seeing the largest growth. So despite our largely public system with our different private spend, the different segments are growing at very different range. And health services and technology, which I thought could be of particular interest for many of you, is really in that sweet spot of growth as we look at the years ahead. And if I break it down on the right-hand side, you can see that data analytics is the main use case in Canada, for which both public and private are excited to pay to go and create value. How do we move patients through hospitals? What can we learn about patients in the workforce, in their lives, to help them serve better? Lots of questions that are raised. Obviously, healthcare information systems and software. We see a range of bespoke solutions in Canada. Obviously, Epic being one major player. But each market have their own dynamics, and then the core admin services and logistic and supply chains, which also all set to continue growing significantly. Just flagging, this data is all from our proprietary McKinsey profit pool analysis. So I can't go into a ton of details, but wanted to give you a little snippet and a bit of flavor knowing what you all think about. And last piece is tech in Canada is complicated. Well, I won't hide. I've already spoke about the federals and the provincials, very much like you see, the feds in the state in the US. But we know tech can create value. And as I mentioned, the push toward interprovincial interoperability and a really need to scale AI across the country is really demonstrating a range of opportunities for our country and an openness to discuss tech. Right? So this is just an excerpt from our paper on AI for healthcare in Canada. And you can see across a series of relevant segments using AI use cases today. So I'm not talking about things that haven't been demonstrated or, up and coming new advanced model. This is really today that has been studied and demonstrated. We know the system needs tech, and we know the system is hungry for value and scale, and this is just a sense of the value at stake. We estimated that it's probably about 5 to 8% savings in the system, and obviously this is the type of insights that our regulatory policymakers really care about, because there's a real opportunity for us to be more cost effective while improving the care of patients. And then finally, I know it's McKinsey, we got to do 5, not 4. I kept a little hidden myth for you around innovation. And I know a lot of the topic around this table, our different colleagues will speak to the amazing work that they're doing and what they're scaling. But I just want to reinforce how much innovation matter. We published less than 2 weeks ago a piece on the gap in women's health in Canada, leveraging some of McKinsey Health Institute work in collaboration with the World Economic Forum. And just to give you a sense, when we analyze the gap specifically tied to sex, 40% of the women's health gap was tied to innovation and the need to provide better innovation across a range of markets, a range of patient segments, across the lifespan. And those of you that will speak to brain health, we know it's in the top 3 condition impacting women's health and the broader concept of longevity for both sexes. So I really hope this type of data really reinforces the need and the importance of this in the Canadian market and the opportunities that lie ahead for many of you. This wraps up my time. I'll turn it back to Richard. I can't wait for the conversation among us all. And I thank you all for the time today.
That was excellent, Marie. Thank you so much. And I think it gives us a terrific springboard for us to move into the conversation. I'd like to actually start with your last slide around innovation and ask the panelists what have been some of the essential elements supporting innovation in your fields. And I'd like to start with you, Shaf, if you don't mind, and then we can go through and have this conversation.
Yeah, no, I mean, I really enjoyed Marie's presentation, and I think that with some of the geopolitical things happening, we've really got to wake up in Canada and start to show where we are leading the world in innovation in healthcare. And also, I think the investors need to think about Canada. I think the size is important enough to matter, and also the credibility, the quality of the work being done in Canada. So, in my area of transplantation, we lead the world in transplantation, and particularly in lung transplantation. We did the first lung transplant in the world. We did every innovation since 1983 in lung transplantation that has made an impact on the field has come from Canada. So the next step is, well, how do you make that into industries that matter? And certainly, I built a technology to repair lungs outside the body, and that we are manufacturing in Canada and exporting from Canada. But the lung repair centers, we started in the United States over 15 years ago because United Therapeutics could put in $100 million overnight. So, and that was the need. We repair organs at TGH. It's a Canadian technology, a Canadian innovation in healthcare that it saves lives. And yet we could only expand it in the United States to start. So, I think, while Marie said all of those are myths, they're myths that need to be broken. I think too many Canadians still believe that.
That's terrific. Allison, what about for you? You and I had a conversation around precision aging, and I'm curious what that means and what the level of innovation really is required for that.
Yeah, so at Baycrest and Cabby, we're really interested in this concept of precision aging, which for us, because our focus is aging and brain health, what we really are thinking there is we want to do in aging and brain health what precision medicine did for cancer. When I was growing up, if someone was diagnosed with cancer, they didn't even talk about it because there was really almost nothing that you could do. And now my mom has had breast cancer twice. And the second time she had it, she was sort of like, well, don't even bother coming. This is not that bad a one. I'll just get a little radiation. I'll be fine. I mean, you wouldn't have heard that years ago. So we can build on what was done in that field of cancer to now bring it into the aging and brain health space, dealing with things like dementia, for example. And what we're looking at is what can we do with that sort of precision, with that personalized approach to make sure each person gets the right journey in aging for them at the right time, at the right place for that particular person, all the way from dementia prevention through early detection and diagnostics, through treatment and therapeutics, and through care. And so in Cabby, we're funding innovations in all of those spaces, and we're funding them from the very early development stage, development design, through validation and refinement, all the way through spread and scale. And I think that that's a place where Canada has really, really unique strength, because Canada punches above its weight in a tremendous way in terms of neuroscience. And when you look at the intersection of neuroscience and AI, which is going to be so critical for this precision approach to aging, AI, everyone knows Jeff Hinton, the godfather of AI. He comes from Canada. And in fact, he comes from the neuroscience world. So he was a colleague of ours before everyone else in the world knew him. And, so I think that there's a long history in Canada of not just developing things in the neuroscience world and in the AI world, but in the merger of those two, which is so critical for what we're seeing going forward.
Terrific. Janet, I'm going to call on you, and I know you're just settling into the office, but I think this is an important area. I'm curious from an investor standpoint, what do you see as sort of the primary conditions for spurring innovation in Canada, especially in health tech?
Yeah, so in general, when I think about an ecosystem and what an ecosystem needs to thrive, I think it needs the ideas or the passion, the talent, and the capital. And when I look at Canada, I think that, what's exciting is we're improving all three of those. So in terms of, we're seeing more and more entrepreneurs who are see Canadian healthcare challenges and opportunities as an opportunity to leverage, particularly leveraging AI in order to address the challenges. We're seeing more talented people. And I think with respect to talent, so this is a general comment, but applies to healthcare, obviously, is, it requires, ideally, in an ideal world, you have people who have seen and done it before. It's why Silicon Valley is so successful, because you have a critical mass of people who have scaled companies before, so then they can go and help the next company scale. I think in terms of Canada, we're not where Silicon Valley is, but we are getting more and more mature, particularly over the last 10 years, as we've had more success stories broadly in tech as well as in healthcare specific. And so we have more talent who is used to selling technology solutions into hospitals, into doctors, into employers, in terms of like the HR, into medical solutions into the employers. And then in terms of the capital, we don't have a whole lot of capital, but I think what's interesting is, health tech is such a broad area, but what's interesting is, for instance, I'll speak specifically to life sciences. Life sciences in Canada has actually had the highest return of any of the early stage investment class. We've also seen some great success stories in companies, whether it be Point Click Care, which is it's a global company that provides software for the seniors residents, right? Or whether there's other companies like that, we're seeing increasing success. And as you have Canadian health tech companies that are successful, it attracts more capital to the space because they see the potential.
talk to us a little bit more about that. So where are you seeing the areas of interest, the areas of greatest interest for investment right now in the Canadian marketplace?
I think it's interesting. I sort of made a list of like all the different sort of types of companies, right? And I'm sure I'm missing some, but I sort of thought, there's life sciences, there's AI for drug discovery, AI that gets sold into hospitals, or AI/tech that goes into practitioners, tech into pharmacists, AI into employers. Then we have tech sold directly to consumers. I think I would say, in terms of my purview, when I look across the entrepreneurs that I meet with, the most common thing that I see is tech for consumers. I think that is because, and I'm not saying that those get funded, but just in terms of the number of companies, and I think it's because it's relatively easy for entrepreneurs to grasp, hey, here's a problem, let me develop this health tech for consumers. They don't necessarily need a deep understanding.
Yeah.
Being said, I think I've invested in a couple of companies that are using AI as part of the drug discovery process. I think that is very exciting. It is a very busy area, for sure, particularly with a lot of US companies going after that. But, that is definitely an area where I think we're going to see a lot of progress. We have invested in a company called BioSil, which is AI for drug discovery, another company called Banting, which is using AI for the clinical research process. Many years ago, I invested in a company called BenchSci, which is AI for it sells AI to pharmaceutical companies for their drug discovery process or pharmaceutical process. So I think like that whole area is definitely something that's ripe. I know that the feedback and what I've seen in the market is companies, it's a lot easier to sell into pharmaceutical companies than to hospitals. Not saying it's a good or bad, but just they tend to be, it's an easier customer base to sell into. So I think we see more traction and more investment dollars going into companies that are doing that, as opposed to selling into hospitals per se.
Yeah, Richard, can I just add to what Jen's saying? I totally agree. I think we're also in Cabby as an investor seeing a lot of these innovators who come to us and say, I've got this great idea. This is how we're going to help older people across Canada and around the world. One of the things that is holding a lot of those companies back is they don't actually check and see where is the market need, right? So as Janet said, they'll say, oh, I have this great idea. Here's how I can, create something that people need, but they don't actually go out and ask, what is it that individuals we need? What is it that communities need? What is it that hospitals or long-term care homes need? And we did a survey recently as part of our Age Tech Insights report series in Cabby, and the majority of folks 50 and older across Canada want to be helping innovators determine what is needed, but only about 11% of them feel as though they've been having enough of an impact. And at the same time, when you ask them about the technologies that they're using day to day, again, the vast majority, 75, 85% are using it for things like entertainment and even finances, but only about 40% are using it in health. So there's this huge gap that I think there is a big opportunity. But if we're going to help the innovators succeed, they have to be innovating the things that people will need, because that's the only way people will procure them.
And also, if I can, add something to what Janet said. Janet, you talked about AI for drug development. So, I developed techniques to keep organs outside the body. And then we realized that, yes, that saves lives and uses more organs. But the most exciting thing, or another exciting thing, is drug development. Like, you can now develop drugs on human organs supported outside, whether it's a lung or a liver or heart. And that saves decades and billions of dollars on each drug development, because you're developing a drug for the species where it's intended to work. So, I think we need to look at opportunities like that. Whereas, yes, I developed that as a transplant surgeon, but now the interest in investment and in pharmaceutical companies is, wait a minute, you can figure out how to use that drug in a liver or a lung, and that'll save us many years and billions of dollars. Like, that's the way we need to do it. And the FDA said they want to see less animal research and more research done on humans and human organs, so that we do the right thing and also don't go down so many blind alleys. So many things cure problems in rats, but they don't cure problems in humans, right? So I think that's a really important thing in terms of saying now we're actually using AI in that, because we realize there's so much information from these organs that the human mind can't assimilate all that data at the same time. So if we actually put AI in there, it tells you, yes, this drug is working. It's making this lung better. It's making this heart better. Little by little, it's telling you that, yes, we've got machine learning algorithms that not only speed up, but they teach us humans how to do what we do better.
And you can do that at the personalized level as well, back to precision aging. So one of the projects that we're working on with folks at the University of Toronto Precision Medicine Group and Hebrew University in Jerusalem and Baycrest jointly is creating individual people's brain organized. So based on individuals, we haven't done it yet, but this is where we're headed, so that we can then make sure that for someone who's got a particularly difficult treatment approach for, say, dementia, responsive behaviors in dementia, we'll know for Richard what's going to work best for your brain, Shaf for yours, Marie for yours, Janet for yours, and me for mine. So down the road, that's where we do see it going, is sort of brains in a dish or livers in a dish or lungs in a dish, that actually can be not just for the species, but for the individual, which will really help with the precision approach.
Can each of you get in a little bit further to those gaps? How do we bridge the gaps that you're talking about? Because I think the audience, especially for this webinar, would be very interested in understanding what is working. And Shaf, you talked about dead ends. What are some of those dead ends? What are the areas where, I think it requires more support either at the government level or at the health systems level? Go in a little bit further in terms of how we can actually bridge those gaps in the next few years.
I can start. Like, one of the gaps is people not understanding what's really needed. Okay, like, everybody's out there saying sign your donor card. But if you sign your donor card, right, there's an 80% chance that the lung won't be used. That's a huge problem for me as a clinician that does lung transplants to save lives. I see the miracle of transplant, but 4 out of 5 lungs are not used. So I set out to solve that problem. So one is identifying a problem that's useful. Now, philanthropy has really, helped us a lot. Now Canadians are waking up to philanthropy, saying, that's how Harvard became Harvard and Stanford became Stanford, and University of Toronto can be great too if we continue to support with philanthropy. But I think investment needs to do the same. Canadian investment now, if I had invested and developed lung repair centers in Canada instead of in the US, we could have really had a huge company, which now is in the is Lung Bioengineering is in the United States. And now we're using drones to transport organs. We're doing all kinds of things, but that innovation is Canadian. And if I would have had now part of it is my own lack of knowledge at the time. If I would have had the ability or access or the interest from investors in Canadian, maybe that all would have been developed in Canada. So I think that's waking up. Janet.
No, this is great. So I want one thing to build on what Shaf said, and then I'll talk about another thing. So is on what's working. Is there's a new initiative that's just getting off the ground in terms of philanthropy, where an organization has developed a giving back. And so where Canadians can actually contribute to a specific drug, to a drug development and fund that and get a tax write-off. And the way it will work is that drug, let's say I say, hey, I want to support this specific researcher who's working on Parkinson's, for example. I, as an individual, could give $1 million donation. I get $1 million tax credit. That $1 million goes towards furthering that drug. If and when that drug is successful, that $1 million serves as an investment. And that, let's just say everything goes great, you get $10 million back. That goes back into the entity, which then gives it to more drug, to more drug discovery. So anyways, that's just something new that Canada has developed. It's a group of people have been working on it for several years to get it through CRA, that's Canadian Revenue Agency, to make sure that it was a tax treated properly. So anyways, an innovative initiative there. Another innovative initiative within Canada that I think is worth highlighting is something called the Can Health Network. This is a not-for-profit organization that was started several years ago. The objective of the Can Health organization is to match innovative health tech companies with hospitals and clinicians. And what they do is they have 51 what they call edges, which are hospitals, they're basically hospitals or healthcare facilities. And they have 104 companies, relatively small tech companies. They understand the needs of the 51 different healthcare providers. They understand the technologies that are being developed, and they will match them one-on-one with the idea that they find a a hospital or a healthcare facility to trial this technology. And then if the technology goes well, then it is expanded throughout the other networks. To date, they have launched 133 commercial projects, and their companies have raised over $700 million. So again, just a very interesting, you can learn more on Can Health Net organization, but very innovative and very successful.
That's excellent. Marie, Allison, I want to come back to you in a second, but Marie, wearing your two hats of clinician and consultant, do you agree with all this?
Yeah.
Or some of the areas, what would you say we're missing in this conversation?
No, well, the first thing I will just echo what many of the colleagues have so eloquently said, right? So we need to think about financing more broadly in Canada, understanding that, public sector can't not fund everything. So the concept of catalytic philanthropy is something that resonates a lot. In fact, when we analyzed in some hospitals across the country, their foundation is funding 10 to 15% of the hospital innovations. So I think that just reinforces the fact that these are important stakeholders at the table that can really serve as partners to innovate and scale. Then I think the one point I would want to build on that you all didn't touch on a lot is, I think, Janet, you hinted to this, right? Like pharmaceutical as the client. I would say we need to even broaden our aperture even bigger. One of the example I use all the time is Loblaws. Loblaws touches millions of Canadians every week, like double-digit millions, right? So, they're expanding their healthcare offerings. Now they're doing pharmacy, they're doing, healthcare checkup, right? So how do we think about new entrants in the healthcare space and potential partners to help us scale innovative solutions? I think all of us in this space would say healthcare, in the hospital is one part of the answer. It's healthcare outside of the hospital that I think will further grow and change the world. I think new clients or, people that think that way, how do we create and build on that intimacy wherever it's happening, even if it's when you're buying your pasta, right? To then make sure that we also build and address the needs of Canadians, I think is a really interesting idea.
Let's get into something that you also profiled on your slides. And it's a gap that we see all around the world with healthcare workers. So with that in mind, what can we do to actually make sure that we have better support with actual care delivery on the ground among healthcare workers? And Allison, I'll give that question over to you first.
Sure. There is a huge and growing gap in the healthcare worker space. And that in and of itself is a gigantic market that's growing year over year. Marie could give us all of the details in terms of the numbers of that, but it's a huge, huge market. And one of the things that we can do is, again, think about these colliding technologies. How do we bring together virtual and remote learning with AI, with VR, AR, XR, et cetera, so that instead of having to bring people into a particular place to do the training, increasingly what we're starting to see is ways of bringing the training to the people. The same thing with healthcare. We're increasingly seeing remote forms of care. And I think we're seeing the same thing in education. And you might think I'm obsessed with the word precision, but I also have a vision for precision learning, where each person is getting exactly what they need at the same time. So within Baycrest, we're one of the 3 centers for the Ontario Centers for Research, Learning, and Innovation in Long-Term Care. And it's us and Schlegel and Briere together working as a team to support all across the province and indeed across the country and internationally, we've created at Baycrest a virtual training program, say for long-term care nurses and personal support workers, which is a huge, huge growing market. And it's all gamified. And so I think, again, bringing together these different kinds of platforms, learning doesn't have to be just about, come into a hospital or come into a long-term care home and we'll teach you how we take care of patients. It also can be engaging. It can be proactive. It can be used for upskilling. But the other thing that I think is really important is thinking about what is it that we need to train the next generation of care workers in. So we've been talking about AI. We haven't talked yet about like robotics and other areas like AR, VR, XR. But if the people on the ground don't understand how to make use of all of these different tools, and we have the greatest innovation in the world coming in with AI, with robotics, people are not going to accept it. It won't necessarily fit into the workforce. So we're actually in Cabby developing and Baycrest developing training programs for care workers in artificial intelligence, in technologies, in Internet of Things, and so on, because we really have to create that community of innovation as the receptor for these innovations. Because the traditional solution accelerators just they take companies in and then they push them out, as opposed to having both a push and a pull, and having both the things going out and things to receive them. So we have to really train people in understanding. They don't have to become the next Jeff Hinton. They don't have to become experts in AI, but they have to know, what is this used for? How can it make my life easier? So that they will think of themselves as innovators and then be more accepting for the innovations coming out of Schaaf's lab and others.
Schaaf, that's a tee up for you. So give us a little bit of insight on how you're using some of these tools with organ transplantation and within UHN in general.
Yeah, but I think, there's a common theme has come that I think is very important to investors, in the sense that you need people with core content expertise. Like Allison is telling you what human beings need. We're all aging, and what are we going to need? Like, she knows what we're going to need. So she'll know where to go. And just like Marie said, everybody goes to Loblaws. So like, why don't you go get your blood pressure checked at Loblaws? And controlling blood pressure is how you control heart disease and so on. So things like that. So as a doctor, we spun out another company called Halo for telemonitoring. So every hospital in Canada puts a bedside sitter for constant observation. Well, we used AI and technology so that one telemonitor technician can watch 12 patients at the time, improve safety, decrease falls, and improve satisfaction, and decrease family anxiety that someone's watching mom when I'm not there. So like, I saw the need, that we need that. And it speaks to the fact that we don't have PSWs to hire, even if we wanted to hire it. And every innovation doesn't have to cost more. We're saving our hospital $3.5 million a year. $3.5 million University Health Network is saving because of that innovation. So, of course, they have to pay for it. It doesn't come for free, but by the same token, it's a more efficient, smarter way to do it. It's where AI helps us. What's the biggest problem with a baby monitor or a security camera? Is somebody doesn't pay attention. So our innovation was attention detection. If the technician looks away or falls asleep or is playing on their phone, we know it. Yeah. So we can watch them. Night vision, easy. Motion detection, easy. Those are all AI that's out there for games, for other things. We put it in and we're looking after patients better. Why? Because I saw that as a need for our system. I saw that we're spending $6 million a year in our institution for constant observation. And our focus is on patient safety. It's not going to go away. The cost is going to continue to increase. So how do we innovate to provide that care in a better way? And it's the same thing. I mean, I did that with organs as well, saying, we've got all these human organs. People are looking at developing artificial ones and taking organs from pigs and so on. But we've got 80% of organs from humans are not used. Why don't we fix those? And the other part of it is, looking at the whole thing, that we've been doing transplantation in a weird way for 50 years. We transplant an organ into you, then we immunosuppress you for the rest of your life so you don't destroy that organ. You have an increased risk of cancer, you have an increased risk of infections, and you have all the side effects of a million drugs you take a day. How about if we manufacture an organ that looks like self, so you won't reject it, and we don't have to give you all those pills? Well, we could never do that before, but now technology allows us to do that. So I'm sort of saying, we got to change the way we do transplant. Like, don't go changing the recipient. Change the organ, give them an organ that has a chance. And that is all a Canadian idea from Toronto General. Like, it's totally changing transplant. So it again, getting back to it, is you need someone with core expertise to say that. The other part of it is, I'm a consummate academic and I got all the promotions and I'm a full professor, blah, blah, blah. But as soon as I started spinning out companies, people look at you different. You say, well, he's got his own company and he's done this and he's done that and he's got conflict of interest. But the issue is, I saw a need, and the only way to get technologies to the bedside is to commercialize them. You get regulatory approval. Somebody has to buy your device. Somebody has to realize Mrs. So-and-so in that bed needs telemonitoring to be safer in hospital. So I think those kind of things, again, higher institutions are waking up to that concept that you can't just build something in your garage and go do it on a patient, right?
Yeah.
You have to have safety and all of these things built in, which comes with commercialization, which comes with investment, Janet.
Yeah.
And
Rich-
Richard, if I can build on a few key facts, right? Like, the future of healthcare in Canada, knowing the workforce challenges means redesigning workflows, rethinking about the workforce entirely. In a McKinsey analysis, we like 30% of a nurse activity could be shifted or
Yeah.
delegated, automated, right?
Yeah.
So we need to embrace this entirely, because otherwise we won't meet the needs of the next 5, 10, 15 years in Canada. So we were talking about the need. That is a major need.
Yeah.
Yeah. And the other thing, just related to Marie's point and Shaf's also, when you think about Canada, and Marie talked about 10 different systems, there's actually 13 if you count the territories plus the indigenous ones. It's a very big country. We can't reach everybody in person. And so that's where this idea of remote, medicine is becoming even more important. And to Shaf's point, we in Cabby, we supported a company called Jerry MedRisk, which again is the same sort of idea where you're able to meet the needs of different kinds of groups by using remote sorts of approaches for telemedicine, if you will. In this case, focused specifically on drug interactions in older adults. There are no geriatricians. There's not even a neurologist in the Yukon. So how do you make sure people are getting taken care of? We help them work up the case for the government that for every dollar that was spent on this solution, the government actually saved $8. And so the government has invested a good amount of money in it as a core program, and it's now being spread across Canada and around the world. And there's other program examples like that. And the thing that people, I think, need to be realizing then is, when you're investing in health research like this, and you're investing in these sorts of companies, it's not spending, it is investment. And in Canada, we've had our Prime Minister say, we need to cut spending, but we need to increase investment. And, you and I are big fans of brain economy, brain capital, which is also came from a Canadian, the original verbiage of brain capital. And the idea there is really that if we can make investments in this, we'll end up building a better economy for Canada and for the world. And dementia alone, the cost of dementia is $40 billion a year, the cost to the economy, which is the same as our defense budget was last year. It's going up now. If we don't do anything about it by 2050, it will be $110 billion a year just for that one ailment. And so investing in it now actually creates jobs. It increases productivity. It brings more people into the workforce. And yes, of course, it improves people's quality of life.
Yeah. I mean, it's staggering. I feel like we need another hour just to geek out on this piece of the conversation. And unfortunately, good news and bad news. good news is we have a bunch of overachievers in the attendance, and they've taken us up on our challenge to ask questions, and we now have 15 or 16 questions to roll through. The bad news is we got about 10 minutes. So let me go through in some order, and we'll just do lightning round if you guys don't mind. So the first question comes around, how much is invested in finding technologies to lower costs by public versus private sectors? Marie, that might be a question for you just to
Yes.
check out.
You bet. So I would say, as Alison laid out and Shaf in many of their points, the business case of investment to lower costs is very compelling to public sector decision makers. So those are, provincial governments, federal governments, but also health systems. Some of the numbers you're hinting around of, reinvestment, ROI, obviously these are very compelled. I would say on the private sector, the main arguments there are around productivity, or, additional touch points for added benefits downstream, depending on the business, right? My Loblaws example. So slightly different argument. Lowering cost is often a secondary interest, but obviously still top of mind, given our healthcare challenges.
Great. Janet, this question is for you. So for a startup medical device company with some traction and initial regulatory approval in the US, what are some of the easiest, quicker, cheaper tips that you have for market penetration?
I mean, I guess my first thought would be depends on what channel you're going through. Leverage the US, leverage your US contacts ideally to go after whoever you've seen traction with in the US, go after the same group in Canada. So for instance, if you're selling through doctors successively in the US, then try to leverage them as references to get into doctors in Canada or whatever, however, whether it be hospitals or whatever, but leverage those contacts who you have in the US to sell into Canada. I guess I would also actually pause on that and ask and say that an entrepreneur who is in the US, just think through, do you want to go to Canada now? Right. And just most companies are better off sticking with a market. Like if they're already successful in the US, I would say, just continue to penetrate the US if you're having success there before entering Canada. Unless there's a really compelling reason. But I would think it's always going to be easier to penetrate the market where you already are than go into a new market.
And I think we could have a follow-on conversation around some of the reasons why investing in Canada makes sense right now versus not. The next question, this is for anybody who feels they can answer it. Is there a standard certification pathway for medical solutions and platforms in Canada?
Well, I can take that a bit. I mean, it is a bit challenging, but I think in many ways, Health Canada has been a lot more productive and helpful than the FDA, and a lot more move a lot faster. And people assume that there's less regulation in Canada. There isn't. I mean, we still have a lot of hoops to jump through, but by the same token, they seem to be a little bit more sensitive or to the fact that patients are dying and patients need this. So if you can make a good case, and again, this is where I think content expertise helps for where the medical innovation could save lives, could help patients, then I think that route is pretty good. So it is through Health Canada, and there are certain channels you have to go through and processes, and they take longer than you would wish. But in many ways, at least they're logical.
That's great. Let me ask you all this. So what would be the top 2 things that you believe could change in Canada to increase technology and innovation in the healthcare space? It's not a softball question.
Is stop being so Canadian. Like, I mean, a lot of times, I have not been saying as much that we're the best lung transplant program in the world, the best and the largest. Like now I say it quite often because people think, Canada is some third world country. Bullshit. We're the best. We are the best. We are the most innovative. And I think secondly is look for those investment opportunities to build Canadian companies that bring this innovation. Insulin was discovered here at Toronto General Hospital. We never made a dime on that. Okay, and look at how many people in the world and how many billions of dollars were made on insulin. And the same thing with Ozempic, okay? Minimal made here of the billions per year being developed, and yet it was discovered here. So, I think these are the kinds of things where we say, look, there's some blockbusters coming out of Canada, work on it, and take that risk at home.
That's great. So the next question I have is, and this is sort of a hodgepodge of a number of questions here, so forgive me if I muddle it. I think a few people are asking, is there a central hub, a central platform within Canada where innovators and potential investors can go to learn more about specific areas and contacts within the field that they can start to network with?
I can start maybe, and people can join in. I think Janet mentioned CanHealth. Cabby actually helped CanHealth develop their model. It was based on one of our programs. So it depends on what you want to do. If you're looking to sell generalist kinds of things to acute care hospitals, CanHealth is very helpful. If you're looking for anything in the aging and brain health space, Cabby will be helpful for that, the Center for Aging and Brain Health Innovation, because we've got hundreds and hundreds of partners and, have launched, hundreds and hundreds of programs and had, over $1 billion in follow-on funding. We know who all those players are, both in Canada and in the United States and internationally. If you're looking for women's health, which Marie had mentioned at the beginning, there is a women's health network. And so I think that it's not a one-stop shop. One place I would recommend looking, and big shout out to the Creative Destruction Lab. So I'm been a mentor for them in the NeuroStream since it started. And that is, for people who don't know, it started in Toronto through the Rotman School of Management and now has spread globally. And it doesn't provide funding, but it provides amazing resources. So when you are a company that's accepted into the CDL program, you have access to the top people, both on the science side, on the connection side, on the funding side, on the regulatory side. And you have this circle of mentors who can provide you with any kind of information that you need. So that's my answer is I don't believe there's a one-stop shop for everything, but we have a lot of really good specialized kinds of areas. And of course, our trade offices can connect you to all of these as well.
Janet, I'm giving you the last word.
In terms of a one-stop resource, you know what? I'm not sure of a one-stop resource. As I said, I think there's so many different components. But I think, I'll just say another source that hasn't been mentioned that might be useful is the CVCA website. That stands for Canadian Venture Capital Association. There you will find lots of reports just in terms of who are the big investors by sector. You can find stats on investing stats for life sciences and other sources. So I'll just say that. And great to have the conversation with everybody today.
Yeah, thank you all. We said the benchmark for success was 5 questions. We have 20, 19 or 20. We're gonna circulate those questions within our group, see if there's some quick answers that we can compile and send out, because I know that there are a number of questions that people really would like to have answered. And that brings us at our time. I just want to thank everyone on the panel who is able to provide some really terrific insights on this conversation, and also to Levi Shapiro for helping to organize us, and Esther for helping to organize the delegation next month. Thank you again for joining us. It's been a terrific time. Wish you a great Monday.
Thanks. Bye.
Thanks so much, everybody.
Thanks,
Bye.
everyone.
Take care.
Happy Monday.
Bye. Thank you.